equally benefited by Dr. Choisen's seminar. I'm sure about that. So let us make it a grand success. Welcome you all. Those who have not yet registered may kindly register. So now today we are reading chapter 31 of the book, The End of My Assumptions of Miasm. In our last class, we have talked about the sides of the body, the brain dominance, and that has helped us immensely day in and day out. Every day in our clinic, we are able to judge to which side, no, like the predominant side of the patient, or probably the disease, whatever the patient is complaining about. If it is on the right side, we have a set of questions to ask, and if it is on the left side, we have a certain questions to ask. So don't take this as a hard and fast rule, but then I'm confident in saying that even if you take it as a hard and fast rule, no, like based upon that theory of Dr. Hammer, we are able to put forth the questions like what are the conflicts of the patient, and we are able to get the entry into the patient, and 101% times it has been proved, it holds good, or rather it is proved to be the truth. And the patient will be asking like, how do you know this, doctor? And that will be the exclamation of by the patient. Now today we want to read this chapter 31, that is the genetics of psychosis. This is full and full psychosis, and here we are dealing about the proliferation. As you know, the psychosis will be of 4 types. One is the accumulation, the other one is the proliferation, then the third one is deposition, and the fourth one is the synthesis. In accumulation, we just have some accumulation of tissues or accumulation of water, or maybe a retention cyst kind of thing, or a sebaceous cyst, or any kind of cyst accumulation. So, or there can be even edematous condition, like swelling, waterlogging, all those things can be included under accumulation psychosis. Then proliferation will be cell multiplication, and it leads to the tumor formation or growth. And deposition can be any lipomatous fat tissue deposition, lipomatous growth, or neurofibroma, or even deposition can be even stone formations. All these things can be under deposition, or sometimes proteins can be deposited, or calcium can be deposited in our body in certain parts, or some melanin can be deposited here and there, causing the thickening as well as the blackness of the skin. And lastly, it is the synthesis. So with the 2 proteins, that is the fibrin and elastin. If it is hyperpsychosis, and if there is fibrin excess, then there can be the thickening and hardening of the body, and the scar tissue formation, or the keloid, or even the fibroids, no, like there can be fibrous tissue deposition and all will be there if there is more of fibrin. That means more of thickness will be there. And if it is more of elastin, hyperelastin, then there can be constrictions and strictures in our body. If it is hypopsychosis, where there is less elastin, there it can be the ptosis, or it can be the herniation, or it can be the looseness and the relaxation. First, dilatation. If fibrin is more in the cardiac tissue, then it will be causing hypertrophy of the cardiac muscles. And if fibrin is less in the cardiac muscles, it can cause dilation cardiomyopathy, like dilative cardiomyopathy kind of thing. More of dilation will be there. So now coming to the proliferation part of psychosis here. So I am taking you to this page number 241 in my book. Can anybody help regarding the page in the new edition? Adira, can you help it out?
241.
241 is in my book, and Dr. Arya is saying in the new book, it is in the new edition, it is 217. Page number is 217, chapter 31, that is genetics of psychosis. So how is this psychosis happening? Psychosis is nothing but proliferation of cells as well as other products. This shows problem with cell division control. Yes, you know that a cell, how do we all grow? We all grow by the method of cell division, and that is mitosis. One mother cell will be giving to 2 replica of its own kind, 2 daughter cells. So this is the mitosis. So if there is any problem in the cell division control, so if it is 1:4 or 1:5, then there can be the proliferation or the multiplication. 1 is supposed to give only 2, then there will be proper growth. There is no psychosis there. It is only the natural psychosis or the growth of the individual. But if one cell is dividing into many multiplied cells, then what happens? There can be a tumor formation or extra growth, etc. No? So this shows problem with cell division control. So there is a control for the cell division. We in detail, Vijay sir has explained that. We are going to read that. So, and the protein growth factors. To understand the probable cause of psychosis, we need to understand the cell division cycle. This is nothing but our embryology. You all know it. I'll just go through that. Just be close to the sentences. There is nothing to explain there. Cell division is regulated by the cell cycle control system. For anything and everything, there will be a control. And when the control is gone, there will be multiplication haywire, which causes the tumor. The cell cycle comprises of two phases. As you know, it is the mitotic phase, wherein the cell actually divides, and the other one is the resting phase, wherein the cell prepares for the mitotic division. The mitotic phase, as you know, consists of prophase, metaphase, anaphase, and telophase. The resting phase is also known as interphase, where DNA replication takes place. So you know that every cell contains a nucleus, and inside the nucleus are the DNA, the double helix, etc. First, the nucleus will have to, or the chromosomes, the DNA will have to replicate, and then two small nuclei will be formed, and later on the cell division will be completed. So the resting phase is also known as interphase, where DNA replication takes place. The interphase is divided into three parts: G1, S, and G2. So there is nothing complicated here. We shall just read about that. Every cell which has to duplicate has to undergo these above phases. During G1 phase, the cell monitors its environment and its own size. This is kind of a preview. Before you jump into anything, you want to know what are the conditions, what are the surroundings. If you are asked to jump, will you simply jump like that? You want to know the how much depth I have to jump, with what force I have to jump, where should I land. Before you drive, what will you do? Before you take a car from your shed, you will be watching all around the car, and you will be watching in the car shed also. And then what are the nearby vehicles, or is there any ditch there? Is there any bump there? You will be watching all these things, no? And how to take the reverse, in what angle should I take? I should not be scratching the side of the gate, etc. No. So that is the preview. So during the G1 phase, the cell monitors its environment and its own size. If everything is normal and the cell is found fit enough, it is allowed to proceed to the S phase. So this G1 is kind of a control. It is not allowing the cell to just multiply like that without any preview. First of all, you have to take the size of yourself, the cell which has to be replicated, and whether it is matured enough to replicate, etc. No, all these things are there in G1. If it passes that, it is allowed to proceed to the S phase. And what is this S phase? In S phase, DNA replication takes place. That means the cell gets ready for 1:2 multiplication genetically. That's the proper multiplication. Then comes the G2 phase. In G2 phase, the cell ensures DNA replication is complete and proper, and only then the cell is allowed to proceed to the M phase, that is the mitosis phase. So there is nothing here. G1 phase, S phase, and G2 phase. After passing G1, it goes into S phase, where the DNA multiplication happens, and G2 ensures that DNA multiplication is complete, and now the cell also can do the multiplication in the ratio of 1:2 only. Every cell which divides by mitosis into two of its own kind has to undergo this cell cycle, which is controlled by certain proteins, that is cyclin-dependent kinases, CDK1, 2, 3, etc. In this resting phase, we have two checkpoints. One checkpoint is G1 and the other one is G2. So you know the importance of checkpoints. These are like brakes. You cannot simply drive the car in fifth gear and ride fast or rash drive. No, suddenly if anything is coming, you will have to slow down. How will you slow down? What is the checkpoint? You will have to slam the brakes there. So G1 and G2 are the controlling factors regarding the cell cycle. G1 checkpoint regulates and controls the entry into the S phase. See how smoothly it is all done in our body. G2 checkpoint regulates and controls the entry just before the cell enters mitosis. So, before the cell enters mitosis, the DNA replication has to be complete. That is done by the checkpoints G1 and G2. The G1 checkpoint ensures that every cell has optimum growth and optimum cell environment. This is the preview, as we said. If the cell passes through the G1 checkpoint, it replicates the DNA from 1:2. That is, the cell controls or proliferation lies in the G1 checkpoint. If G1 is not up to the mark, or if it is not governing properly, then everything can be haywire, and that is psychosis. If the cells are going in for more replication, G1 checkpoint checks them and does not allow them to proceed. So this is the natural defense mechanism in our body, or this is the natural check or the controls in our body. Controls are always needed. When it goes past the control, if it goes beyond the control, that is psychosis, and that is abnormal. So there are certain cyclin-dependent kinases, namely CDK2, which combines with another protein, that is cyclin E, to help the cells to overcome the G1 checkpoint or bypass the checkpoint, even if the cell does not have the proper growth. This is exactly the psychosis. Even when the cell is not really ready for the multiplication, just like bribing, just like bribing the police officer, you will be able to take the car, with the drugs or something, you will bribe the police and run away with the car. Similarly, G1 checkpoint also can be bribed sometimes, and that is exactly which miasm, on the sly or manipulating. So that is nothing but psychotic miasm. So this is probably the start of psychosis. Are you all with me? Hope you are able to understand this. This is very, very simple. I don't want to go into too much of details. Here the cell tries to bribe its way or manipulate its way through the checkpoints, and hence tries to synthesize more DNA so that more than 2 cells are produced. This is the start of proliferation, excessive cell production, excessive production or synthesis of protein and enzymes. Everything goes in excess. Everything goes in quantity beyond what is needed. If everything goes according to the need, then there will be it is all completely normal. The growth is normal. Every human being has to grow. We cannot say that, okay, that is bad psychosis. That psychosis, the growth of the body itself is psychotic. Dr. Kyle, Arya, is it possible to mute it or not? Okay. Thank you, dear. So,
sorry, ma'am. It showed it was muted. Sorry, ma'am.
It's okay, Kalvedi. It's totally understandable. Yeah, it happens. So, so that's what extra or more than what is needed. If it is synthesis of protein, more enzymes, all these things are nothing but psychosis, where more of melanin is produced or more of adipose tissue is produced, or where even the amyloidosis happens. No, unwanted places, unwanted deposition happens, more production is there, that's why it is deposited, more uric acid is produced and that is deposited. All these things are nothing but psychosis. The psychotic constitution probably has more of the CDK2 and cyclin E combination, which makes them undergo multiplication or defense by construction since birth. We know that we all have all the 3 miasms. SORA, psychosis, and syphilis are the only 3 miasms, which is in par with the inflammatory response and the constructive response and the destructive response in the body. We all have all these gears. We all have all these responses, all these defenses. By birth itself, we all have this. But then certain persons will be predominantly soric. Certain persons will be predominantly psychotic. Since birth, they have the constructive defense, or the SORA will be of a very short span, and immediately they go into the next defense, that is construction, even since birth. That's what is Vijay sir is saying. So there, in such a body, there will be more of this CDK2 and cyclin E combination, so that they will be able to undergo the psychosis so easily. That is there in their genetics. A person having predominantly soric miasm may be suppressed by drugs or other factors, and the G1 checkpoint could be overcome. So where there is suppression of SORA by strong antibiotics or due to some such cases, like children who are having very lean, thin, puny children, but then they will be having bilateral tonsillar hypertrophy, and initially it will be continuous tonsillitis, and eventually it reaches into kissing tonsils, and that itself is the going towards psychosis. But then it is not full-blown psychosis because the body is still lean, the child is still kind of underweight. The moment they remove the tonsils, the moment they do the tonsillectomy, the child within 1 month, he is totally a different child now. He has put on a small tummy and he is all chubby and that. How does it happen within a span of 3 to 4 months? Immediately after surgery, the gear changes fully into full-blown psychosis. That is, it crosses the G1 checkpoint, and thus that sudden precocity, that sudden overgrowth, that is psychosis, thus leading to psychosis. This is a probable explanation for children going from psoric recurrent inflammatory disease to psychotic disease. What is psychotic disease there? They can easily land up in a juvenile diabetes or even hypothyroidism in that age of 8 years or 9 years. So young, they can go into psychotic disease after operation of the tonsillitis and appendicitis. So when the psoric disease is checked this way, then immediately the psychosis defense is blown out. Many patients start becoming fat after delivery or after major operation or after acute inflammatory diseases like typhoid, pneumonia, hepatitis. Or rather, no, like that surgery stimulates, it pushes the body to go into the next gear. Psychosis gene is activated in the person. We homeopaths also do suppress. It's not that we don't suppress, we also do sometimes bad suppressions. In cancers too, it is the G1 checkpoint which has been seen to be defective. But one gene giving rise to multiplication tendency, that is overcoming of G1 checkpoint, is the same as what is probably called as the proto-oncogene. So this is the precursor of the oncogene, that is the proto-oncogene. That gene which can undergo mutation and eventually lead into cancer. We all have such mutations happening, but then it will be one of a kind, or it will be very minimal, or it will not be able to combine with another thing, or it will be put down there itself. Even if it is coming off as a flame, it will be put forth that there itself, so that it will not spread, or that kind of a multiplication is not encouraged in the body, or somehow we are able to slam the brakes, or the G1 gets back its controlling power because of our stable genetics, or because of our predominance of SORA, etc. So if it is a predominantly psychotic thing, then there will be no controls. And if it is going to syphilis, then absolutely there will be no control. So this goes step by step. Even initially there will be one oncogene, and that is a precursor of the oncogene, that is the proto-oncogene. And this gene is the potential thing to undergo mutation, further mutation, third degree mutation, fourth degree mutation, and eventually everything will be insane, and that is nothing but cancer. One oncogene does not necessarily cause cancers. Yeah, it requires minimum 2 oncogenes to cause cancer in a person. Presence of one oncogene stands for cancerous diathesis, which in other words may be equal to psychosis. Here still the controls are there. The gene of proliferation is responsible to police the normal cell. There is another gene called gene P53, which acts as a brake on excess cell proliferation. So body has got all sorts of defense mechanisms to put the brakes to prevent the abnormal cells coming up. When one thing is not enough, body will take up the help of the other higher mechanisms to slam the brake somehow. What will we do when we are in control of a car? No, like when the brakes are not working, what will we do? We will try to reduce the speed of the car, no, like by shifting from the top gear to the third gear, and then to the second, then to the first. We will use the next alternative. No, similarly, the body is using the next alternative, that is the gene P53, which can also act as brake on excess cell proliferation. Somehow the excess cell proliferation has to be curtailed. It has to be kept under check. Gene of proliferation can be either inherited from the parents. We know cancerous things are all in the lineage. It is hereditary sometimes in the family. When you go into the family history, you know that both the sides, and the great grandfathers, everybody having cancer in the family or many number of cancers in the family. So this gene of proliferation, that is P53 gene, may be inherited from the parents, or it can be acquired during the lifetime process of reverse transcription. Those who inherit are psychotic constitution. So this is it, yes. So when there is a psychosis predominance in the body, the genetics are made in that way that ready to jump into the proliferative phase or to produce the tumor or the cancer. The cancer diathesis they are already in. So now the next chapter is like genetics of cancer. We shall read that also. And after that, if anything is to be discussed, we can discuss. Are you all with me? Good to proceed to the next chapter. Any doubts so far or any case to be discussed regarding your cases or anything? Arya is saying yes, okay. Is it okay for all of you then? Yes? Thank you. So it is the genetics of cancer. Yeah, Lataji, thank you. And see, you all know the difficulty in treating cancers, no? Maybe we will have to take one separate lesson or separate topic as cancer. Maybe in one of the CMAs, we shall ask any experienced doctor to take a class about cancer also, because we know in our clinics, it is growing number of patients. No, any day we will be getting some or the other cancer cases, and sometimes we are at a confusion like what to do. So in cancer, what do you do generally? Will you give a genotype or a phenotype? That is the biggest question. That is a multi-dollar question. And what is a genotype and what is a phenotype? Genotype is the GCS or the genetic constitutional simillimum, where you all know how to take the case, taking the totality, the disposition, the thermals and thirst, and you all know how to give the medicine. That is the constitutional simillimum or the genotype, according to the genetic constitution. But then phenotype, already the gene has undergone a mutation and this person is not the same. There is personality disorder, or there is alternation of the personality, and it is the state remedy. Phenotype is nothing but the state remedy, where the pathology is of the fourth degree or of the last degree. Even if there is no cancer, or even if there is no schizophrenic things, that means in the sixth layer and the seventh layer, we generally give the phenotype. What is the sixth layer and seventh layer? In sixth layer and seventh layer, the element of Sora is not there. There is total personality change. In the sixth layer, we get the autoimmune disorders. In autoimmune, the person is changed, no? Because our own immune system is working against our own, it is working against, it is antagonistic with oneself, which means that personality or that identity is totally gone, and now you are getting a new person with a syndrome, some autoimmune syndrome. So this is an alteration of the personality itself. So there, the original sensitivity or the Sora or the original emotions as a child does not carry any meaning, because the person sitting in front of you is totally a changed person. So here you have to employ phenotype, or that is the state remedy. Similarly, in the seventh layer, that is the genetic mutations and malformations, already the genes itself are changed. Not only the immune system, it is much deeper. It is in the cellular level. It is in the chromosome level. There itself, the change has happened. And cancer is nothing but a mutation of the genes, which means it belongs to the seventh layer. In the sixth layer and seventh layer, the original nature, the disposition of the person is changed. So that changed condition has to be taken into consideration for the sixth layer and the seventh layer. And cancer also belongs to the seventh layer. So now coming to the genetics of cancer. So here we have to give the phenotype, because the personality is already altered. So what is this altered person? You have to give importance to this altered disposition. Please explain state remedy. That is exactly what I am explaining now. State remedy means the person is at that state, at what state the patient is coming to you. Yeah, when a person is coming to you in a homeopathic case taking, you will be sitting for 1.5 hours to the patient, and you will be taking the history right from the childhood days. You need not give any importance to the childhood personality of this person. Okay. You are giving importance to the present state. That is the state remedy. That is exactly the state remedy. Dr. Jayadev, are you able to understand this? Are you able to understand what I'm telling you now? See, when a patient is coming to you, for example, in his age of 60, yeah, he is coming for diabetes. And the diabetes is just like maybe around 200 to 300. Fasting is more than 250 and after food is more than 350. And the patient is already taking the anti-diabetic medicines. And still, no, it is somewhere around that level itself. And maybe the patient is now complaining of the complications like some blurring of vision or the diabetic neuropathy also. He is not able to get sleep. Now, this is the case. How do you approach this case? You will do the normal case taking, isn't it? You will, of course, you will classify the disease. You will classify into miasm. What is the miasm here? It is hyperpsychosis. It is hyperglycemia. No, more of sugar is there. More of glucose is there. So it is hyperpsychosis and it is slowly going. It is layer number 5 and it is slowly going into the 6th layer. That is the nervous tissue is also getting affected. Here it is not autoimmune diabetes. It is the normal diabetes. So here still you can give importance to the SORA. So here still you are going to give him a genetic constitutional simillimum by considering his childhood days, his sensitivity, what were the journey of the disease, what were the layers of the disease which he had crossed from the first layer till the 5th or the 6th layer. This will be the detailed case taking. And here the personality is not altered. Here the personality will be the same as before. So here you will be giving importance to the disposition of the patient and the thermals, thirst, etc. And then you will be ruling in and ruling out the medicines. But if it is an autoimmune thing, the parents also, the bystanders will be clearly indicating that he was not, or the patient himself will be giving you the case like that. Previously, I was like that and now I am like this. Of course, you can get this kind of an answer with a word of caution in the psychotic miasm, where the patient will always want to project a facade. He will want to project that he is good. So even then you will be able to do a little bit of CID work there and you will be able to find it out from the child or from the wife or somebody, no? Like from the bystander. Then they will be saying, no, he was like that only before also. No, that is the psychosis miasm, the cunningness of the psychosis. Leaving that behind, coming to the point, there will be a real change. It is not a facade. There will be a real change in the personality in autoimmune cases, etc. Previously, I was very sensitive. Now, no, after seeing some death or where any sad news also, I am not affected by that. Now, kind of, I have become rather indifferent or I have become hard-hearted. I used to pour and pour. I used to cry by seeing a horror thing or a sad movie. But now I am able to see all that things just like that. No, that sensitivity is gone now. The SORA itself is gone and the basic defense itself is gone and it is slowly moving towards death because it is autoimmune. It is killing your own body. It is crippling your body, the rheumatoid arthritis or the syndromes that is crippling your body system by system. Many system in your body is affected. So autoimmune means where it is already going into the syphilis. So there, the state of the patient is important. Previously, I was very chilly and now I am hot. I always want full fan and full AC. I don't want any cover. Even I can't bear the touch of the cloth, etc. etc. The patient will be coming and telling you, no. So here you know that previously it was chilly and now it is hot. Which one should I take? Now I have to take the state remedy, that is the present symptom. Now you have to take it as a hot patient. But the bystanders will be telling you, oh, previously it was very chilly. No, we don't want that now because now we want the state remedy. So now are you hot or chilly? Now it is clear-cut hot. I am taking cold bath. I want full chillness of the room and yeah, etc. You will be getting the stories, no? Like some partner will not be able to lie with him because he wants a AC temperature for 16 and the other person is not able to stand all those stories will come. Then you will be able to calculate correctly. You, the keen observing physician, otherwise you cannot ask directly to the patient, are you hot or chilly? Patient will be saying something. You have to prove it by asking such kind of things. Then the other person will be saying, no, we are not able to stay in that room. It is icy cold. Then you know that this person is a hot patient. You can confirm that. Similarly, every point you have to confirm regarding the thirst and thirstlessness, regarding the desires and aversions. Of course, I will not be telling you about the desires and aversion. They are not that very important unless there is a PQRS in that desires. No, like If any unwanted stuffs, like if any perversion is there, if they have got desire for anything very, very pungent, or like when normal people will not like and they will want to eat that kind of a thing, it's just like cow dung kind of thing and all. They want to smell such kind of things. Then, if it is PQRS, is it possible, Arya, to mute it? Yeah. So, like if any, like PQRS is there regarding the desires and aversions, that can be taken. Or if there is any pica, yes, that can be taken because it's a PQRS again, or because it is abnormal again. Anything which is abnormal can be taken. Am I clear, Dr. Jaydev? Like, what is the state remedy? Yeah. I think that I have explained in too much detail about what is a state remedy. What is in present of you right now? What is the altered person right now? What is the changed personality sitting in front of you right now? That is the state remedy. We will get the previous history as well, but then we know not to use all those things now. When the patient has reversed back to his sora, once the patient gets back his sensitivity and emotions, then you are justified to give the GCS if it is needed. Why? Because the Materia Medica is so strong, our medicine is so strong, it is proved, it has got all sorts of miasms in that sora psychosis and syphilis. And many of the medicines are tri-miasmatic. If you have taken pulsatilla, for instance, as the state remedy, pulsatilla still can be his GCS as well. So sometimes there will be no need to give a reanalysis of the case or to give a new remedy. There will be no need to give a new remedy because the PCS or the so-called phenotype itself can be the genotype. But in certain cases, it will not be like that. If any change is required according to the need of the patient, you are justified in changing the remedy. Phenotype and genotype, mostly they will be related. Mostly they can be the same remedy, or sometimes it can be the inimical remedy, or sometimes it can be the from the relationship remedy or the complementary remedy, or sometimes it can be any other remedy XYZ also. Am I clear? When to give GCS, when to give PCS, and when to give the like in case that is when to interfere the case. Like after the phenotype, when the patient has improved a lot, and if he is coming back to the psoric phase, and if he is having any complaint, then only you have to give the GCS after the PCS. Am I clear regarding this thing? Any doubt is there regarding this thing? This is very, very important. Very, very important. Especially important in which case? In cases of cancer or in cases of insanity. Yeah, these are the cases where you will have to give the anti-psoric, as Hanuman has rightly said, our master has rightly said. Once the acute exacerbation is treated by giving the state remedy like aconite or belladonna, stramonium, hyoscyamus, merxol, veratrum or ignatia, when the patient has undergone calmness, when that high levels of hysteria or whatever mania the patient was having, or whatever cancer the patient was having, or whatever sepsis the patient was having, or whatever delirium the patient was having, once the patient has come down to this level, come down to a lower level, and now the patient is showing a different picture, you have to change the remedy. You have to give the anti-psoric. What do you mean by anti-psoric? That is nothing but the genetic constitutional simillimum. Am I clear? Am I clear?
Ma'am, in case of patients on allopathic medication, in case like in
Yes.
maniac cases or any insanity cases, and they will be coming up with different symptoms. So, like what? How do we choose a medicine for
Oh,
them?
very difficult, Rosemary. Two diseases you have to tackle at the same time. One is the disease of the patient, and the other one is the disease produced by the medicines. You have to go in through the prescription. What are the remedies given, and what are the symptoms, or what are the indications? Now it is very easy, like you will search in the mobile phone in the Google, and then you will find it out, and then you know that these are the side effects. But then there again, Rosemary, the same answer. You have to give the state remedy. What symptoms the patient is presenting in front of you, because already all the effect maniac depressive psychosis all belong to which layer? Seventh layer. They don't have any sora there. And whether it is the prescription disease or the direct disease of the patient, the remedy is the same. It is the state remedy. It is the state remedy. You do the best case taking possible and fill up all the needs of the doctor, like what are the symptoms of the patient to be treated, what is the presenting complaint, and make a note of it and give the best possible remedy. Once the patient starts improving, like all these so-called ailments have come down or better personality has come up, then sometimes you may have to change the remedy or you may have to give the antisoric remedy if the case demands. But mostly for insanities, it is always a new personality will be shown up and you will have to take the case immediately and give the GCS, because it can go back. Because why does it go back? Again, another question. Why does it go back? Especially in the case of mental diseases, you have to be very, very careful, because many doctors are capable of treating all these maniac symptoms by our drug remedies, by our delirium remedies, very effectively. By giving 50 mg one dose, you will be able to tackle all those kinds of violences, manias, dromomania, running around, everything you will be able to tackle. The patient will come back to you saying a thank you immediately. Don't forget, immediately you have to take the genetic constitutional, you have to take the case and give the GCS. Why? Because it is very, very volatile. This insanity is nothing but air kind of thing. It is highly volatile. It is like as if it is on fire. Immediately with the next trigger, the patient can go back to the madness again. So for him to be stable, for the mental disease, it has to be converted into a physical disease. It has to be grounded. It has to be rooted. For that purpose, you have to bring back that person to the ground. Now the patient, after giving the so-called high remedies, the drug remedies, the patient has come to the ground level. Catch him immediately. Don't leave him like that. Immediately you have to prescribe an antisoric remedy, the GCS. Yes, Rosemary? Have you understood this?
Yes,
Yeah.
yeah.
Even
Thank
in
you.
case of cancers, you know that even after chemotherapy, how many of you have seen this? Patients are all getting better by the seventh sitting of cancer, eighth sitting, ninth sitting of cancer. Okay, patient is better. And now all the sittings are fully over, and now the patient is sent back home and no more checkups. The next checkup is only after 6 months. What happens in the 6 months? Suddenly, for no obvious reasons, the disease flares up again. That is insanity. This is cancer. So this insanity in the physical is cancer, and insanity in the mental is the so-called psychiatric ailments. So you have to be extremely careful, and it is quite difficult also to treat cancers now. Yeah. Because you think that the patient is all getting better. Immediately you have to give the GCS. You have to redo the case and give the next remedy, because these cancers are all like mutation. Again, the next mutation will happen. With the slightest trigger, again, the next mutation will happen. Why? Because the patient is already out of control. Whether it is really psychiatric insanity or body insanity, the patient is out of control. The patient is behaving insane and mad. The cells are behaving mad. The cells are multiplying like anything. And any time with the slightest trigger, the next mutation will happen. It will go into some other organ. It will go into the next stage. No, that happens in cancer also. So in cancers and in psychiatric ailments, you may have to change the remedy, the state remedy itself, the next state remedy, the next state remedy, the next state remedy. And sometimes you think that this is the GCS and that will be a state remedy. No problem. According to the symptom of the patient, you will have to change the remedy. Don't hesitate to change the remedy in the seventh layer diseases, especially in the dynamic volatile diseases, not genetic diseases like any the children, no, like we very often see MR children, CP children, palsies, and ADHDs. All these things are also belong to the seventh layer. But then here you will not change the remedy at all. You will wait for some 6-7 months together, or even for 1 year, even for structural changes like scoliosis, this thing and all, no, where genetic malformations are actually there. You will be waiting with 200 potency for 1 year. You got the point? Where will you change the remedy again and again? Only in case of highly volatile, highly dynamic things where the patient's case demands the change. Yeah, because it should be similia similibus. If it is a very, very slow thing, like if it is a very, very slow evolving disease, like what to say, in the case of a cerebral palsy case, for example, is it dynamic? It is not at all dynamic. It is kind of a static thing. The patient will be sitting in without any neck holding and with lot of spasticity and with MR also sometimes, mostly, and the patient will be in the stretcher or in the wheelchair. And do you expect the patient to get up and run away soon? Because it is not dynamic. How many months will you have to wait? Even first of all, there should be the neck holding, and then the spine alignment should become normal. The craniocaudal alignment should become normal. Then slowly the sides and all will become normal. Up, above, downwards improvement you will be able to see, and then the layer wise improvement you will be able to see. And by that time the eye contact will get, the squint eyes and all will be getting proper. No, this alignment takes time. There is no magic for that. Here, there is no need to repeat at all. One dose given properly analyzed medicine, you give the patient, and you see how beautifully, just like the blooming of a flower, slowly, 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 day by day, the child is getting better and better and better. The convulsions are reducing, the intelligence is better, and how the child is looking at the mother's face for the first time and smiling, and how the faces of the child itself is becoming more and more beautiful and lively, and how the parents are getting much more hope and they become better, their health also become better. With all these judgments, you know that the child is improving. Slowly, 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 the child is improving. So here, similar similibus, no need to repeat at all. But in the case of insanities, where one day, one picture, another day, another picture, and everything is violent and the third grade, how do you tackle that? You will have to change the remedy there. It will be a state remedy all the time, many times. We are coming to that now. Now, again, we are going into the chapter 32, genetics of cancer. What is cancer? Cancer is a result of genetic mutation. When genetic mutation takes place, there is a gene called gene P53, which acts as a brake on excess cell proliferation, not allowing the mutated cells to go further in cell cycle. Yes. See, in the cell cycle, everything is in a cycle in the body. The physiological cycles are there. All of those are cycles. Cell cycle is also there. So the body has got that intelligence to prevent the mutated cells to go into the cell cycle. The body takes care that the mutated cells should not go into the cell cycle. It will not allow the mutated cells to go further in the cell cycle. It will stop there itself. So the further mutation will not happen. We all have mutated cells, but then our defense mechanism is so strong that it is kept under control. The mutated cells will not go into production of abnormal cells. If the mutated cells undergo the cell cycle, abnormal cells, a group of abnormal cells will be keeping on produced in the body. That is curtailed. This prevents malignancy. This prevents malignancy. When P53 gene is defective, that is when the cell break fails, the mutated cell proliferates. That is, the proto-oncogene turns into oncogene. And then slowly, slowly it goes into full-fledged cancer. Why? Because the P53 gene, or the protective gene, the defensive gene is defective. Got it? This is how the mutation is not checked, and the mutated cells are also undergoing the proliferation. There is nobody to control there. We understand that our constitution is based on genetic code, which has representation of our physical and mental characters. If a part of proto-oncogene is replaced by DNA, which has been reversely transcribed, a new oncogene is formed. Cancer can be formed only if there are two such oncogenes. Yes, so this reversely transcribed DNA is the most dangerous thing. When, if it is part of the proto-oncogene, then a full-fledged cancer can develop. This is something like from a thick book of Robin's pathology. a few pages have been removed and replaced by pages of Kent Materia Medica. So it is not like a book of Kent. It is not like a book of Robbins. It is a mutated thing. Yeah, the book does not make sense in this state. It is no more a book of Robbins' book of pathology. Same is the case with cancer patient with genetic mutation. When there is genetic mutation, the personality itself is altered, no? Because we are all like this with a certain physique. Probably talk about Dr. Arya, for example. Like she is having this much height and this much weight, and she has got a pear-shaped face, and she has got curly hair. Sometimes she will be having like little bit like light brown colored iris and that beautiful smile. How does that happen? Because it is already inscribed in the genetics. It is already there in the genes. So that is how it is. In cancer cases, the gene is already mutated, so the personality itself is changed. Thus, in cancer patient too, the basic characters of the original constitution are not helpful to prescribe upon. This is what we have talked about as the state remedy. The original constitution is gone now because the very genes have underwent mutation. The very genes are now changed. So the personality is altered. So the original constitution is not helpful to prescribe upon. Each genetic alteration may cause phenotypic changes typified by the progression in epithelial tissues from hyperplasia. Initially, it will be only a hyperplasia, that is the first degree, to adenoma, the second degree, to dysplasia, that is the third degree, to carcinoma in situ, that is the fourth degree, and to invasive carcinoma, that is the full-blown thing. How? First mutation, okay, only hyperplasia. Again, mutation happens. Adenoma, next layer. Again, mutation happens. Dysplasia happens, that is totally out of control. No, the syphilis is full blown. As far as it is hyperplasia and adenoma, we still have a scope because it is in the psychotic phase. But then it goes to dysplasia, out of control and altered, and perversion has already happened to the cells there. And that is when you do the biopsy and you find out that, okay, there is changes in the cells. The cells are dysplastic, which means it is going towards malignancy. And then further mutation happens and it will be carcinoma in situ first, and then it will be metastatic. That is, it is invasive carcinoma. That is the full-blown thing. Isn't this insane? The cell itself is changed and the personality itself is altered. Just like insanity of the mind, it is insanity of the body. So here Vijayakar sir has guided us properly by taking such kind of a rubric that insanity suicidal. Insanity suicidal can be taken in full-blown cancers, where it is fast-moving syphilis. It is running towards death. There it is kind of insanity suicidal because the cells are all destroyed. All the cells are bad cells, or all the cells are kind of necro cells or black or dysplastic cells are produced in the cancer cells. And mutation, like insanity, it is multiplying again and again and again. There is no control. Absolutely, that is insanity. Where there is no control, it can be insanity. And the cells are bad cells, or easily destroyable cells are produced in the body. Who wants that kind of a thing where there is no proper growth? It is only destruction happening in the body, and that is nothing but suicide. So insanity suicidal can be one of the most beautiful rubric in the case of a fast-moving cancer, any kind of fast-moving cancer. Did you get that? Are you with me? All good?
Yes, ma'am.
Thank you. So now cells have evolved mechanisms. Yes, cells have, see, just like how we put the PSLV or something into the atmosphere, no? Until this much kilometers, it will be going as a full rocket, and then the outer part of it will be detached and that will fall down, and the rest of the thing will go up to certain part of the space, and there it will break and then break open, and the next part will be going up. So, like stage by stage, it has got that evolution. Cells have evolved mechanisms to resist neoplastic transformation. Stage 1 resistance, stage 2 resistance, go to the next gear, no, go to the next gear. Like the cells are already having that kind of mechanisms to protect and to resist the neoplastic transformation. Body has got that control already, to prevent the psychosis and to prevent the syphilis also. When this mechanism is distorted, unfortunately, the cells grow out of control. This means the defense mechanism has failed. Yeah. Brakes have gone. This amounts to syphilis. Thus, cancer is at the genetic level and it is a syphilitic disease. So, by this, our guru, mentor, Dr. Praful Vijayakar sir has proved that cancer is at the genetic level and it is a syphilitic disease. In previously mentioned genetic mutation cancers, it is advisable to prescribe on phenotypic simillimum and not the genotypic simillimum. Yeah. The changed phenotypic simillimum is based on changes in generals, changes in physicals, changes in mentals occurring after the onset of cancer with due respect to strong psychotic symptom which is not changed before and after. What is this now? We have already talked about the state simillimum, about the state remedy, that is the phenotypic simillimum, which means the changed person, or which means the generals, the changed generals, the changed physicals, and the changed mentals. When, from when on? After the occurrence of cancer. What are the changes in your body after the occurrence of cancer? Take hold of those symptoms and prescribe upon that. Of course, if any strong PQRS kind of psychotic symptoms are there, which you are not able to let go, you can take that psychotic symptom. For example, it can be fastidiousness kind of thing. Mind you, it is not SORA. It is psychotic symptom, like excessive craving for money or excessive fastidiousness, something like it. It can be money related thing, or fastidiousness can be psychotic. But then if it is a PQRS kind of strong psychotic symptom, which is not changed before or after, that can be taken in as a rubric in order to rule in or rule out, probably, in order to fix the remedy. In order to fix the remedy, in order to be sure about the phenotypic simillimum, you can make use of such kind of strong psychotic character. Got it? But mind you, it is not the sensitivity, it is not the SORA. According to Harrison's, there are 5 series of phenotypes. So this is what I said about the change of the remedy. 5 times probably you may have to change. It is not 5 times and all. It is according to the need of the patient. Our medicine should be similibus to the case. When you think that this is not helping, you have to change it. Again, it has helped for a while and now it is standstill and it is kind of going back. No, you don't want it to go back. You again change the remedy. You again reanalyze and give the next state remedy. This happens. According to Harrison, there are 5 series of phenotypes occurring in cancerous growths and a possibility of changing of simillimum at every structure of change will lead homeopathy to fantastic possibilities of cure in cancers. See, with one remedy, you cannot cure cancer. Initially, due to my, immaturity or lack of knowledge, when I was into predictive homeopathy initially, way back in some 20 years back, where I started treating all the so-called diseases so easily with one dose of medicine, and I started eliciting Herring's law in every case of mine, just like I was like as if I was riding a horse or something. It was so beautiful after coming to predictive homeopathy that I had lot of doubts of my own before joining in predictive homeopathy. Like after giving a certain medicine, the patient is coming back, and again I give a medicine and the patient is coming back. And then I thought that when will the patient stop coming to me? When can I tell this as a complete cure? Or when can I publish this saying that this patient is completely cured and all that? So I had all these doubts, and then I joined predictive homeopathy, and then I understood for the first time that there are layers, these embryological layers, or the tissues, or what to say, the germ cells, how they are classified, and what all cells, what all organs are formed from what all cells, what are the tissues behind, and what will be the next symptom. Just like that, you will be able to predict it, and this is known as the Herring's law. For the first time, it was an eye opener to me. So from that time, so I was actually treating cases like anything, and everything was a success at that time. Came a cancer patient to me. It was a urinary bladder cancer. What did I do? I took the case, and then it was a clear-cut Oram case. There was hematuria, everything. There was severe pain, and the patient was unable to lie down, and he was having aggravation night, not able to sleep. Okay, I gave him Oram Met. What happened? That guy, that gentleman, improved like anything. And I had given him lot of PL and all that. I asked him to come back after a month's time. There was no hematuria. There was no pain. The father is sleeping nicely. The son was so happy. And then he came back saying that again he is deteriorating. But then I can't repeat. No, I had given 1 dose of Oramet and I'm waiting. So this was actually I could have saved that patient. But this was the lack of knowledge that I should not repeat. I should only give 1 dose. Like that kind of an obstinacy is not good at all. So according to the need of the patient, you should have repeated that. Like given to Vijay sir what he would have done. He would have given it in 10 potency. If it is similar syllabus, he would have given in 10 potency. Why? Because it is a full-blown case of cancer. There the bladder tissues are already destroyed and he was urinating blood. There was hematuria. So that is total destruction. And there he would have given a hypotency and he would have repeated that. And then when the improvement has stopped, he would have changed the remedy. He would have changed the remedy. I did not change the remedy. So this is what it is. Don't hesitate to change the remedy. Your medicine should be always similar syllabus to the case, and your aim is to not to alleviate the symptoms, but then to bring back the patient back to life. It is the reversal of the patient from the sick to health. This is the mission of the physician. Every time you have to see whether the health is coming back, whether there is reversal of the sickness. If the improvement is stopped, retake the case, give the next state remedy. Again, there will be improvement for a while. Okay, the patient has come back some 80% better. It is only 80%. And now
Hi, ma'am. Voice breaks.
possibilities of cure in see the Herring's law, like reduction in the symptoms, in the severe symptoms. So in the syphilitic symptoms are all reducing and the patient is kind of putting on weight. The patient's generals are getting better, able to sleep, able to move around. There's a smile on the face, which you know that the life is coming back. And now you know that it is time to change the remedy. Yeah. Take the case again, give the next state remedy. So similarly, bring back the patient from the sick to health. It is not that, okay, I have given XYZ remedy, now I have to wait. No, you will be destroying the patient. You have to make sure that the patient is getting better. Initially, there was improvement. So I know that the patient will get better or some obstacle to cure or some sensitivity. And you ask and you don't get anything and then the case is gone. Yeah, it should not be. So you should retake the case. You should understand that this is the call for the next state remedy. Yeah. So this is many young homeopaths think predictive means single remedy, single dose. Thank you breaking this myth and explaining it. Thank you so much, Sophia. About the requirements for repetitions of dosage or change of remedy, yes. Only thing is, predictive homeopathy is a classical homeopathy. It is a Hahnemannian homeopathy. Vijay sir has not violated any rules. He has only added as an eye-opener regarding the suppression chart, which is from the embryology, which is from the human physiology. He has not invented a new person. He has not invented a new theory. And the suppression charts and the Herring's law, which he has explained by examples and explained like mathematics. That's all. He has explained whatever Hahnemann physiology, anatomy, and the embryology there. That's all. Vijay sir has not changed any rules. So, where were we? The basic rule of homeopathy is likes cures likes, which means it is similia similibus curanter. Not only regarding the medicine, it should be regarding the potency and it should be regarding the dose. Who said this? Our master said this. In which aphorism? In aphorism 3. You should know the disease, knowledge of the disease. Yeah. What else? Knowledge of the medicine, the sphere of action of the medicine. You cannot give any XYZ medicine for any XYZ disease. It should be similia similibus in everything, and you have to use the judgment of the physician to find out how the dose can be. In every case, the dose will be different. How? According to the susceptibility of the patient, according to the sensitivity of the patient, the dose will be different from person to person, and the repetition will be different from case to case. So in aphorism number 3, all these things are given. So it is not, predictive homeopathy is not like single remedy, single dose. It is similia similibus to the case. That's it. If it is a cancer, you cannot wait by single remedy, single dose. Why people are thinking about single remedy, single dose in predictive homeopathy is that maybe they would have seen the 7th layer diseases where Vijayakar sir already gives so many examples, and the so-called psychosyphilitic diseases where the genes are mutated, the such kind of MRCP cases where you will be giving single remedy, single dose, 200 single dose for many months together. Yeah. So, or Vijayakar sir would have emphasized this again and again that only a single dose is needed. A single simple dose is needed to cure, for a complete cure of a patient. Vijayakar sir would have emphasized this many a times. And we have also seen, if it is a any XYZ disease, how many doses needed? With one dose from the 5th layer, you can bring the patient down to the 1st layer. And that single dose was given 2 years back. Yeah. So this is predictive homeopathy. Sophia. And in the COVID patient, how did we treat? From the ICU and ventilator, Vijayakar sir has given us the COVID protocol, and accordingly, I have employed, like sir has given us the chart. Based upon that, Ophelia remedies, lactose stennum or Crotalus stennum, people have come and collected that in distilled water in amber colored bottle I used to supply, and their relatives will be applying that topical application, not one time, many times, every 5 minutes. If the patient is able to inhale, then inhalation many times. Or if the patient is able to take it orally, 5 ml of that every 5 minutes, 10 minutes, and the oxygen saturation became stable, and the nurses will come and check it and tell that, okay, no need of the ventilator, etc., come out of the ICU, yeah, and the patient is completely normal. Sometimes if still I'm not able to eat, but then I am not able to get sleep, like that fear or something, any symptom will be there that you can give by, not by COVID protocol, give the GCS, take the case and give the GCS. Hope it is good. Are you with me? Yes. So this also is predictive homeopathy, where there is lot of repetition, where there is highest potency and many repetition. Yes, this is also predictive homeopathy. I want to tell something that gone out of my mind. Okay. This is in keeping with the treatment suggested by Hahnemann in his aphorisms, where he mentions the treatment of one-sided disease and disease with paucity of symptoms. But there is another type of cancer which is epigenetic, and where genetic mutation does not take place and only expression of genes is changed. Epigenetic cancers are easy to cure. Here, a genetic constitutional simillimum based on original characters of constitution still works. Such cases are found in old age, and the prognosis with homeopathic treatment in such cases is better than genetic mutation cancers. Did you understand that last statement? I shall give you an example. It's already 11 o'clock, so we shall wind up soon. So there was a case of a continuous ulcer, a non-healing ulcer in the lateral side of the tongue. You know that lateral side of the tongue is a kind of a precancerous lesion, and it is a non-healing ulcer. And by the jagged wound, you know that it is cancerous. Maybe it was precancerous, and there was no gland and all that. Nothing was there. Only thing, the patient was not able to eat properly, and the ulcer was there. You know, by the look of it, you know that it is cancer. And I did not send him for any check or biopsy and all. And the patient also was having that severe fear that it is cancerous. Two cases are there. Two cases I will explain in one blah and finish off. Okay. The first one was a lady, and she has brought, this was 10-12 years back. She has brought a full list, and she was so very enthusiastic, and she was explaining and explaining and explaining. So what is that remedy? Explaining and explaining, and one first point explaining for half an hour, then second point explaining for 40 minutes, and laughing and vivacious and full of energy. What is the remedy? You tell me. It is a GCS. Lachesis. Lachesis. Anybody will give lachesis, and it was a cancer or probably a precancerous lesion, and it went off with one dose of lachesis. Why? It is the genetic constitutional simillimum was given to this kind of a cancer, where the original characters of the constitution still works. It may be a cancer, it may not be a cancer, but then by the look of it, a physician will be able to judge. No, like when I tell you also, you will be able to understand that there is a hidden cancer there. Yeah, that non-healing ulcer on the lateral side of the tongue. Another person. Now you have to tell me the GCS here also. This person was a gentleman around 65 plus, and he was very lean and emaciated, and he was talking to me with so much of fear and fear and fear, and he was kind of this was his body language. And he says that I know that you will cure this. I don't want to go for that biopsy and all. I don't want to go for any other treatment. What is that? It's all fear. It's all fears. It's a fearful remedy. Fearful remedy means
Arsenic.
arsenicum can be one remedy. Fearful remedy.
Stramonium.
Phosphorus,
Strand.
stramonium,
Calcarium.
calcarea,
Phosphorus.
Caliars.
ars, silica. Why do we want to imagine any remedy? I shall come to the point, and you all will be mathematically, you all will be throwing the dark just at 10 on 10. Yeah. The patient was carrying a book. What is this? So I asked, what is this book? And when the patient had to explain, no, he will keep the book on the table and he will show, and then again he will touch that book. What is that?
Clinging.
Yes, clinging. And what is that remedy?
Ammonium.
Ammonium. And what potency will you give? 1M potency. And I asked, what is this book? That is also important. It should not be a novel and all that. No. What do you expect? A religious book? Yeah. It was some Sharada Madam, some book it was. Sharada Madam, written by Shankaracharya or something. He was full time, he will be reading that book. And he said this to me. Even while sleeping, before sleeping, I will read that, and I will keep it under the pillow, and on top of that, I will sleep. Now, what is the remedy? It is stramonium 1M. And what do you expect this cancer thing to disappear or what? With that genetic constitutional simillimum, it disappeared totally. And it was a rapid, gentle, and permanent cure. So this is homeopathy, and this is predictive homeopathy. Okay, with that note, love you all, dears. Have a great practice. Wish you all good success.
Thank you, ma'am.
Thank you so much, ma'am.
Thank you,
Thank you so
ma'am.
much. Enjoyed lecture so much.
Yes.